talk about the ion discussion. I'm going to start with the sodium and chloride. So they have a relation that chloride bonds to sodium. Some signs and symptoms of a high sodium, which is hypernatremia, is convulsions, pulmonary edema, hypotension, and tachycardia. And then I wrote down a little saying or a little phrase called fried that was on the PowerPoint because I thought it was a good way to memorize it. And it's F is for like flushed skin, fever, fluid retention, R is for restlessness, I increased blood pressure, E is for edema, and then D is for the decreased urine output and the dry mouth. Some ways like dehydration and elevated blood levels and sodium level is like another like the lab values that go with this. Sodium gain or water loss can cause this. Hyponatremia, some signs and symptoms of that is compulsive water drinking, they're always thirsty, a decrease in urine, muscle twitching, headache, and weight gain. Some things that can cause this is the SIADH, and then too much water or water excess. And then for chloride, hyperchloremia, it can be due to excessive sodium loss related to chloride or dehydration. It can cause hypertension, edema, thirst, and fluid retention. It can also be caused by diarrhea, kidney disease, and then certain medications and too much salt. Hypochloremia occurs with hypernatremia or bicarbonate deficiency. Some signs and symptoms. Of a low chloride is hypovolemia, so like a decreased blood pressure and increased heart rate, dry mouth for dehydration. And then this can be managed by treating the underlying disorders. And then it can also be caused by vomiting or even cystic fibrosis. So that's what I have on my sodium and chloride. Next, I'll do potassium. So some relations to potassium is the concentration is maintained by a sodium Na positive and K positive pump, and this regulates intracellular electrical neutrality. Some signs of hypokalemia can be a decreased neuromuscular excitability, muscle weakness, muscle atony, and dysrhythmias, which is a big one. Some medical importance is it can be caused by a reduced intake of potassium or maybe an increased entry and an increased loss of potassium. Some signs of hyperkalemia, which is above 5.5, is some mild symptoms are muscle irritability, tingling in your lips and fingers, and then some severe signs is muscle weakness, loss of muscle tone, and flaccid paralysis. This can be caused by an increased intake of potassium or maybe a decreased renal excretion, and also a shift of potassium from ICF can also cause that. So that's my one for that. We can do calcium and phosphate. Some calcium and phosphate can go together because they both have concentrations that are rigidly controlled. And there's a little, if one is high, the other's low. So some symptoms of hypocalcemia is increased neuromuscular excitability and muscle cramps. And there's a decreased block of innate sodium into the cell. Some signs of hypercalcemia is an increased block of sodium into the cell. And then some signs and symptoms is a decreased neuromuscular excitability, muscle weakness, increased bone fractures, kidney stones, and constipation. Some signs of an increased phosphate is osteomalacia. I'm sorry if I'm saying that wrong. Muscle weakness, bleeding disorders, anemia, leukocyte alterations, and acids. Some signs and symptoms of hyperphosphatemia. Sorry, I probably said that wrong. It's similar to hypocalcemia. So there's a muscle cramps, and then high phosphate levels are related to low calcium. So that's my one for that. And then my last one is magnesium. Some signs and symptoms of hypomagnesium are associated with hypocalcemia and hypokalemia, tetany, convulsions, hyperactive reflexes are some signs and symptoms. For hypermagnesium, magnesemia, sorry, I can't say that one either. Muscle depression, weakness, hypotension, respiratory depression is also another sign of the high magnesium. And then some drowsiness and bradycardia. Yeah, this is my thing again. So those are my concept maps and over the ions. Thank you.